Your dog's slowing down. But it's not just age. That's stiffness. It's pain. Hidden arthritis. But here's the hope. We can ease it. Let's bring their comfort back.
You know, trying to figure out your dog's arthritis, it can feel like a total maze, right? There's just so much information out there, so many different products, and all you want is to help your buddy feel better. So today, we're going to cut through all that noise. We're going to map out a clear, evidence-based path for managing canine osteoarthritis, or OA.
Oh man, it's just one of the toughest things to see, isn't it? Maybe they're a little stiff getting up in the morning, or they kind of hesitate at the bottom of the stairs. Maybe they're just not as pumped for that daily walk. That little slowdown, that's usually the first clue that something hurts, and it's a feeling every single dog owner dreads. But recognizing it, that's the first, and honestly, the most important step you can take.
Okay, so here's our game plan, our roadmap for this whole thing. First, we're going to get a solid handle on what arthritis actually is. Then, I'm going to introduce you to a really cool tool that vets use as a map for treatment. After that, we'll lay down the foundational care that every dog needs. Then we'll build a specific treatment plan right on top of it. And finally, we'll talk about something super important, patience, and what you can realistically expect.
All right, let's dive into Section 1, Getting a Grip on Canine Arthritis. Because really, you can't fight an enemy effectively if you don't know what it is you're up against.
So, osteoarthritis, OA for short, is what's known as a progressive disease. That just means it tends to get worse over time. What's happening is that the protective cartilage in the joints is breaking down, and that leads to pain and this constant low-grade inflammation. But listen, here's the most important thing to remember. While we can't cure it, we can absolutely 100% manage it. The goal here isn't some magic cure. It's about managing the pain, improving their movement, and making sure our dogs have a fantastic quality of life. Okay, so how do we go from just knowing our dog has arthritis to actually having a real, concrete plan? Well, you need a map. And the good news is your vet has one.
So, this map is a system called the Canine Osteoarthritis Staging Tool, or you'll hear it called COAST. Just think of it like the staging systems for other diseases. It lets your vet figure out exactly where your dog is in their OA journey. It goes from stage 0, that's a dog who's just at risk, all the way up to a really severe stage 4. The point is, this isn't just guesswork anymore. It's a standardized, proven way to build a treatment plan that is tailor-made for your dog's specific needs right now.
All right, before we even start talking about pills or injections or anything like that, we have to build the foundation. These are the things that every single dog with arthritis, or even one who's just at risk for it, absolutely needs.
And there are 5 key pieces to this foundation. First up, owner education, which, hey, is exactly what you're doing right now. Second, and this one is huge, is weight optimization. Every single extra pound is like a sledgehammer on those sore joints. Third, the right kind of nutrition and diet, especially things like omega-3s. Fourth, appropriate exercise. Not too much, not too little, to keep their supporting muscles strong. And finally, rehab or physical therapy. These 5 things, they're the non-negotiable base for any solid management plan. And this visual, it just nails the whole strategy perfectly. It's called the base and build approach. You see, you start with that solid foundation for every single dog, no matter what stage they're in. Then, if the disease progresses, you start to build on top of it. You add treatments, you adjust things as your dog's needs change. It's a system that makes so much sense because it grows with your dog. Okay, base is set, solid. Now, let's talk about how we start building on top of that, stage by stage. So, let's start with COAST Stage 2. This is what we'd call mild arthritis. And, this is often the point where you, the owner, first start thinking, something's not quite right. Your dog is showing clear signs, but they're still pretty mild.
Okay, now this table, this is gold, because it just cuts right through all the noise and confusion. For a dog with mild arthritis, a big group of international experts unanimously recommends sticking with that foundation and then adding a core pain medication. That's usually either a classic NSAID, that's a non-steroidal anti-inflammatory drug, or a newer type of injectable medicine called an anti-NGF antibody, which is really cool because it targets pain signals directly. Then you have these other options to discuss with your vet, things with a bit more debate around them. This structure is amazing because it helps you and your vet focus on what's proven to work first.
But what about when things get a bit more serious, when we move into the moderate and severe stages, like COAST Stage 3 and 4? Well, the plan has to get stronger too. We need to bring in more tools from the toolbox.
So first thing you'll notice, we're not throwing anything out. We keep everything from Stage 2, and now we start adding more. Surgery, like a hip replacement, becomes something that's unanimously recommended to at least talk about. But the real game changer here is the recommendation for adjunct pain meds. These are drugs like amantadine or gabapentin that you add on top of the main painkiller. This is what vets call a multimodal approach, and honestly, it's the absolute gold standard for managing more advanced pain. You're basically attacking the pain from different directions, which gives you a much, much better result.
All right, this is maybe the biggest question every single owner has. Okay, we started the plan. When am I going to see my dog feel better? It's a totally fair and crucial question, but the answer, well, it's not always right away. And this timeline is just so helpful for setting expectations. Yeah, some things, like putting an ice pack on a really sore joint after a walk, can give relief in just a few minutes. An NSA, it might start kicking in within hours or a couple of days. But some of the most important parts take longer. Those new anti-NGF injections, it could take a few weeks to see the full benefit. And something like adding omega-3 fish oils to their diet, it can take 2 to 3 months for those to build up in their system to a level where they're really doing their anti-inflammatory job. The big takeaway here? Patience is absolutely part of the plan.
And that brings us to something that trips up so many of us: supplements. This quote from a dog owner online, man, it just hits the nail on the head, doesn't it? It perfectly captures that worry we all have. The world of supplements is like the Wild West. It's largely unregulated. That means the strength, the purity, the actual effectiveness can be all over the place from one bottle to the next. It just confirms that feeling you have, that you're right to be a little bit skeptical.
So, after all that, what's the one thing you really need to remember? It's this: you are not in this alone. This whole thing is a partnership. Your vet is your guide, using tools like Coast to navigate this journey. But your observations at home, noticing if your dog is having a good day or a bad day, that's the vital information they need to fine-tune the plan. Always remember, a plan with multiple layers, that multimodal approach, is always going to be better than hunting for one miracle product. And please, be skeptical of flashy marketing. Stick with the evidence-based advice you get from your vet. Look, you don't have to have this all figured out overnight. It's not about having every single answer right now. It's about taking that first step. So, think about it. What is the one single thing you can do today to start this journey? Maybe it's just picking up the phone to schedule that vet appointment for a cost evaluation. Maybe it's deciding to skip that extra treat and start a real weight loss plan. Or maybe it's just taking a quick video on your phone of your dog struggling to get up so you can show your vet exactly what you're seeing. Whatever it is, that first step, that's the most powerful one on this entire journey.